Hi, everyone. Thanks for joining us today. My name is Liz, and I serve as managing editor for the Control of Communicable Diseases trilogy. I have the privilege of being joined today by three of the editors of the series, Dr. Catherine Troisi, Dean Ali Khan, and Dr. Omar Khan. Thank you all for joining me today. We are going to have a brief conversation with each of the editors about the future of public health as well as about the trilogy. But before we dive into some of our questions, I wanted to provide a little bit of background about CCDM for those of you who may not be familiar with the trilogy. CCDM has been in print for over 100 years. It is the oldest infectious disease manual still in print. It covers a wide range of diseases and is edited by experts all over the world. There are three different books in the trilogy. There is the core manual, the clinical manual, as well as the lab manual. So like I said, today we'll be having a conversation not only about the trilogy, but about the future of public health. And with that, I'd love to turn it over to the editors so they can introduce themselves and their current roles outside of their work on CCDM. Kathy, can we start with you?
Yes, hi, I'm Kathy Troisi. I'm on the faculty at University of Texas Health Science Center at Houston School of Public Health. I also have a leadership position in the Texas Epidemic Public Health Institute. I am an infectious disease epidemiologist.
Great, thank you so much. Dean Khan?
Hello, I'm Ali Khan. I'm a medical epidemiologist, professor of epidemiology, and dean of the College of Public Health at the University of Nebraska. I had a long career in public health, 25 years at CDC before becoming dean, and I also serve on the executive committee of the Global Outbreak Alert and Response Network for WHO.
Great. And finally, Omar.
Hi, good afternoon, everyone. My name is Omar Khan. I have a background in medicine, tropical medicine, and public health, and I attempt to practice a little bit of each on occasion. I serve as president and CEO of the Delaware Health Sciences Alliance, which is our academic alliance of our health system, universities, and medical schools across the Delaware Valley. And I'm very pleased to be here with all of you today.
Great, thank you so much. So to get us started, I do have a question for the whole group. My first question is, what do you think are the major infectious disease threats in the world today?
I'm happy to start off with, unfortunately, a rather long list of things we're worried about. For me, what I'm watching very closely is the avian flu H5N1 situation. You know, if you ask epidemiologists what keeps them awake at night, it's flu, even though our last pandemic surprised us with the coronavirus. But we're still very worried about flu for a lot of reasons. We have this avian flu that has infected a number of mammals that we haven't seen before. Dairy cattle are a major source, and so we have had some infections in humans directly from either poultry or cattle. But now in Missouri, we're seeing what could be human to human transmission. And because the flu virus can mutate easily, can reassort, I'm just very concerned about this as our potential next pandemic.
I would agree with Kathy. I mean, we know inevitably there will be a next influenza pandemic. We don't know if it's going to be this H5N1, but we need to be prepared. I also worry about, obviously, antimicrobial resistance. But in terms of the next threat, we know it's likely to be zoonotic in nature, so from an animal to humans. And we have learned repeatedly that a virus that's spread via respiratory route very efficiently poses a great threat to us, such as another coronavirus outbreak.
I certainly agree with my very informed expert colleagues here. I think these are all important conditions. And I think we saw just as when COVID came up, COVID zoomed to the top of the lists of morbidity and mortality worldwide very quickly. And so my concern about the infectious disease threats of tomorrow are not just microbial. They actually are the determinants of infectious disease. And what I think is one of the most important infectious determinants of infectious disease, as I mentioned in my talk at APHA last year, is actually apathy. Apathy and injustice and inequality are the root causes of infectious diseases and of morbidity mortality. My late colleague and acquaintance, Dr. Paul Farmer, described this very well in his book, Infections and Inequalities. Unlike Paul, I'm not an anthropologist, but at the same time, we know that that is infectious as well. Apathy to the plight of others is infectious. But luckily, as Dr. Troisi would be happy to know, there is a vaccine for that, and that's called empathy. And that's the kind of work that I think we embody across the American Public Health Association.
So for my next question, Kathy, this one is for you. I was hoping you could talk to us a little bit about the role of information and misinformation within the context of public health and what that looks like for the public.
Yeah, and thanks to Dr. Khan for bringing up about apathy, which is part of the fruits, if you can put it that way, of misinformation. You know, we have seen, if we're talking about vaccine preventable diseases and the lack of vaccination, particularly in newborns and children, there are a number of reasons for it. The pandemic didn't help, and there are other structural issues in the United States. It can be lack of insurance, it can be transportation needs to get to the vaccine clinic, taking off time from work, things like that. But unfortunately, we are also seeing the effects of misinformation about vaccines. I'm old enough that I was one of the first people to be vaccinated against polio. And you can bet that my mother was fighting her way in line to get me vaccinated, just like every other mother was. You know, polio was very scary. Kids would be fine one night and wake up the next morning and have to be put in an iron lung. We don't see that. Thank God we don't see that anymore. But because of that, there's an amnesia about how these infectious diseases can affect children. And so, because we don't have that context anymore, again, thank goodness, but it has led to misinformation about side effects of vaccine, about necessity for vaccine being spread through social media, also not around when I was a baby, so that we have seen immunization rates decline around the world. It's not just in the US. So we are seeing outbreaks of diseases we thought we had under control. We had eliminated measles from the United States, as well as some other countries. Now we're seeing outbreaks. We're seeing outbreaks of pertussis. I think Dr. Khan's going to talk about polio. And this is very concerning because we know that we need community immunity. If enough of a population is protected, then a virus, a pathogen, can't spread. However, even if overall the immunization rate is, say, 95%, there are pockets in schools, for example, in certain communities where it's not that high. And so these diseases can spread and spill out to the population in general. So this misinformation topic is a difficult one to address because I think it was Mark Twain who said a lie goes around the world before truth has tied its shoes. This is particularly true with social media. We're all into our own little bubbles when it comes to what we hear about and listen to. And they're, unfortunately, public health, and I think Dr. Ali Khan is going to talk about this. So another thing that is contributing to this hesitancy about vaccinating, again, particularly children, is this general distrust of government that we've seen over the last, I don't know, couple of decades, I would say. And because a lot of public health is governmentally done, this distrust has spilled over to public health in general. So that if you're reading on social media from your group of friends that don't get this vaccine, it's not necessary, it can cause these horrible side effects, and on the other hand, you're hearing from your local public health department, get vaccinated, this will protect your child, who are you going to believe? You trust that first group and not necessarily the latter group that you're hearing from. So this is another issue that is contributing to vaccine hesitancy.
Thanks, Kathy. So you mentioned polio, which is a great segue for a question I want to ask Omar. So polio is one of those infectious diseases that we thought we had eliminated, but despite our best efforts, we have not, given ongoing situations in areas like the Middle East. Could you talk to us a little bit about the role of public health professionals in some of these diseases that we've tried to eliminate, but have not yet succeeded in doing so with?
Sure, absolutely. Thank you, Liz. I think polio is a great case study for kind of global health and global affairs in general. Polio tends to be kind of the canary in the coal mine for when certain health systems break down. Back in 2006 and 2008, when my friend Tim Brooks and I were embedded in WHO teams that were vaccinating against polio, we wrote a book published by APHA Press called The End of Polio and has a question mark at the end. And I insisted on the question mark because my former dean at the Johns Hopkins School of Public Health, D.A. Henderson, who oversaw the smallpox vaccination program, said, I'm not sure it can really be eradicated. And so at that time, there were three countries, three or four that had polio: Afghanistan, Pakistan, and two others, Nigeria and Niger. Now we still have two endemic countries for polio. Pakistan and Afghanistan are still on the list. But the reason for their being endemic for polio has very little to do with the virus itself. But the fact that these are war-torn, ravaged areas in remote settings where it's difficult to get the vaccination in a place of trust, going back to what my colleague Dr. Troisi was talking about, misinformation, disinformation. But you layer that on to more complex stories. Sometimes when we have time, we can talk about what does 9/11 have to do with polio vaccination? Well, that's how actually the US got the main architect of 9/11 was through the polio vaccination program in Pakistan by essentially hijacking it for a military end. So there's a lot of geopolitics embedded within that. But let's get to the question around polio and where its outbreak is right now. The polio outbreak right now affected some children in Gaza who were affected by polio, and there was a child who was paralyzed in August of 2024. For every one child who comes up with paralysis, probably 200 to 300 other infected but don't show those same kind of symptoms. So polio tends to be an indicator of much wider breakdown of society. But that's evident. There's an ethnic cleansing going on in Gaza, in the occupied territories. There's a war undergoing. And frankly, for the folks who are undergoing this on a daily basis, polio is not the number one concern. Children dying is the number one concern. Almost 15,000 children have died. And so when we talk about polio eradication, we have to put that into context. What's the bigger context of the lives of these people? What kind of empathy are we showing towards their broader societal conditions? Once we have that, once we have the trust, at that point, we'll be able to vaccinate kids on all sides of whichever borders we care about. Just as one example, there was an outbreak of polio in Israel in 2022. That was the last outbreak. After that, there was a system-wide mass polio vaccination campaign. After this one in Gaza, there has been a system-wide response by the WHO. 640,000 children have been vaccinated. Unfortunately, there hasn't been a cessation of hostilities, as D.A. Henderson used to call it in the smallpox days, to allow for that vaccination to occur. So unfortunately, until we address the underlying societal determinants of infectious disease, I think there's a destined to continue. Polio is just one small example of that. But, I'm wearing my polio tie today that a friend of mine at the Rotary gave me many years ago. And so I'm still optimistic. There's still the question mark behind the end of polio, but I'm still optimistic.
Great. Thank you so much, Omar. My final question is for Ali. I would love to get your opinion on leadership in public health. Obviously, in your role as dean, you deal with the next generation of public health professionals on a daily basis. Would love to know what you think mentorship looks like for them, how they can get involved in organizations like APHA, and just what role they play in general in public health.
Omar, both you and I can add to that because trust is a critical issue if you think about polio eradication, right? It's not about we have more than enough vaccines. It's not about vaccine issues. And access is an issue because they show up at your door to vaccinate you, right? It doesn't get any better than that. It's the trust is the issue. And I would say the same thing, when we think about leadership, is why leadership training is so important for our students, because we need to make sure that they're trusted by their communities. And part of those skills that we train on with our students is about building that trust within their communities. Now, the good thing about our students and leadership is that I think that our students already have the core characteristics you need for leaders. They have integrity and they're passionate about helping their communities, addressing the inequities in their communities and social justice issues. The rest of it, it's our responsibility to teach them as you think about visioning, strategic planning, collaboration, communication, all skills that are teachable to our students. And part of being with APHA is that they get to develop those skills as multiple sessions for students as they advance through their careers into faculty or practitioners or whatever they end up doing. So the APHA is a nice way for them to develop those skills.
Well, I couldn't agree with you more, Kathy and Ali. I think trust is so paramount to every public health endeavor that has ever been undertaken. By definition, we put the public in public health, and it's so important because we're out in the community. We talk about patient-centered medical home. Actually, it's more like a doctor-centered medical home because people come to my office when I'm a physician seeing patients versus when I'm a public health professional, I'm going to their home. That's actually patient-centered care. And so, trust, whether we talk about eradication of infectious disease, whether we talk about reproductive health programs, the incredible work that has been done in contraceptive education in places like Bangladesh, was all due to community-based trust. The lack of trust and erosion of trust is equally powerful. As Kathy said, the truth has barely got its socks on while the lie is halfway around the world. Well, sometimes we shoot ourselves in the foot, metaphorically speaking. As I was telling the story about the hijacking of the polio vaccination campaign in Afghanistan and Pakistan, after that was done and documented as being done by the CIA, polio rates went up about 100-fold in those two countries in the next 3 years while we rebuilt the trust among polio vaccinators and having enough polio vaccinators going out there. But in a show of leadership, to Ali's point, the deans of the schools of public health in the US actually wrote a statement to the White House insisting that public health and politics be kept separate. And it's incredibly important for them not to be interfering, but actually to be complementary. The military has a role to play, for example, in ensuring safe zones for population to get access to care, for them to get access to vaccinations. So there's a great complementary partnership, but not interference. Actually, they got a response, believe it or not, from the head of the CIA and the White House saying, we're not acknowledging that this happened, but it won't happen again, or something like that. So it's a remarkable story, and it's actually been told in Scientific American and AJPH and other places. So public health leadership is critical to building trust in the future. That's going to be how we help control infectious diseases in the future.
Great. Thank you so much. Well, I think that brings us to the end of our time for today. So I sincerely want to thank the editors for joining us and for providing us with their expertise. Until next time, thank you so much.